Thank you to the organizers, to the AARS for putting this on today. So today I'm going to be telling you about a project we've been working on to better characterize the non-lesional skin of acne patients. So the development of acne lesions is multifactorial and involves these factors that kind of impact the follicle, including hyperkeratinization, C. acnes proliferation, excess sebum production, and inflammation. So while the features of acne lesions are well characterized, less is known about how non-lesional skin might contribute to lesion formation. By gaining a better understanding of the genes and pathways that are altered in non-lesional skin in acne patients, we could possibly identify new therapeutic targets to restore acne-prone skin to a healthier state. We hypothesize that there are intrinsic differences in the gene expression patterns in non-lesional skin from individuals with acne when compared to healthy individuals with no history of acne. So to address our hypothesis, we analyzed RNA sequencing data that was collected from the non-lesional skin of 49 individuals with acne and 19 healthy controls with no history of acne. 4 millimeter whole skin biopsy punches were collected from the upper back of all participants, and then RNA was isolated and sequenced. We performed differential gene expression analysis, gene set enrichment analysis, and transcription factor activity prediction and connectivity mapping. And then this is just a table showing the demographics of some of the participants in the study. So the mean age was around 25, and then in the acne cohort, the IGA score was around 2, corresponding to mild acne. So we first used principal component analysis to gain a broad view of our sequencing data. We found that the non-lesional acne skin and the healthy control skin distinctly separated along the first 2 principal component axes, indicating that the tissue status was one of the largest drivers of variation in our data. We then performed differential expression analysis, and we found that there were 226 downregulated genes and 141 upregulated genes in the non-lesional skin relative to healthy controls. And when we looked at the top differentially expressed genes, we found that many of them were related to epidermal differentiation and innate immune response. And this included things like late cornified envelope proteins 4A and 6A, which were downregulated in the non-lesional skin. The S100 calcium binding proteins S100A8 and A9, which were upregulated. And stress-associated keratins, keratin 6C and 16, which were also upregulated. So overall, this kind of shows that the non-lesional acne skin exhibits some signs of epidermal stress and innate immune activation. Next, we did gene set enrichment analysis, which can identify biological processes that are driving phenotypic differences between groups. We used a collection of 50 gene sets that encompass well-defined, highly conserved biological processes. And what we found was that there were multiple metabolism-related gene sets that were positively enriched, such as oxidative phosphorylation, fatty acid metabolism, glycolysis, cholesterol homeostasis, and then in addition, mTOR1 signaling was positively enriched. And when we used a more detailed collection of gene sets, we again saw positive enrichment of metabolic pathways, but we also found that keratinization was negatively enriched. So from this analysis, we really found that the non-lesional skin had a higher metabolic activity that's predicted from this, as well as altered epidermal differentiation. So next we used a special type of enrichment analysis that can predict the activity of transcription factors that could possibly account for the differences in gene expression between 2 groups. And we found that there were 10 transcription factors that were predicted to have increased activity in the non-lesional skin relative to healthy controls. And SREBP1 and SREBP2 stood out to us since their predicted activity was so much higher than all of the others. And these transcription factors are central regulators of lipid metabolism, with SREBP1 regulating genes that are involved in fatty acid synthesis, and SREBP2 regulating genes that are involved in cholesterol homeostasis. So next we focused on identifying compounds that could possibly prevent acne lesion formation by using a method called connectivity mapping. So to do this, we utilized the Library of Integrated Network-Based Cell Signatures, also known as LINCS, which is a publicly available resource that's generated by treating dozens of cell lines with thousands of different compounds that are also known as chemical perturbagens. So the cells are treated with the compounds, then they undergo transcriptomic profiling to generate a chemical perturbagen signature. And then separately, we can create a disease signature that's made up of all of the differentially expressed genes in the non-lesional skin relative to the healthy controls. You can then compute the similarity between the disease signatures and the chemical perturbagen signatures, and then a positive score represents signatures that are more similar to the non-lesional skin, whereas a negative score represents signatures that are more similar to the healthy control. So when we did this analysis, we limited the chemical perturbagen signatures to those from compounds with a known mechanism of action, and that resulted in around 8,000 compounds. After calculating the similarity between the non-lesional acne signatures and the chemical perturbagen signatures, we found 187 compounds that could reverse the non-lesional acne signature toward healthy controls, and 178 compounds that could basically mimic the non-lesional acne skin or shift the healthy control skin toward the non-lesional acne signature. And then we also looked for overrepresented drug classes amongst these results. So when we looked at the top reversing compounds, we found a few drugs that have already shown some efficacy in treating acne, including calcipotriol, which is a vitamin D receptor agonist, which has showed some modest efficacy for acne, as well as tretinoin, which is a retinoid receptor agonist, which is commonly used for mild acne. And identifying these compounds really gave us some confidence that there might be other therapeutics in this list, or other compounds in this list that could have some therapeutic efficacy. Then when we looked at the top mimicking compounds, we found drugs that can cause acne as a side effect, such as glucocorticoid receptor agonists and androgen receptor agonists. And again, this just sort of helped validate our findings. We performed an additional enrichment to look for overrepresented drug classes, and we found that mTOR and PI3 kinase inhibitors were enriched among the reversing compounds, and that glucocorticoid receptor agonists were enriched amongst the mimicking compounds. And mTOR has been previously hypothesized to play a role in acne, since it's an upstream regulator of lipid metabolism, and it could possibly modulate sebum production. So this led us to ask if mTOR inhibitors could possibly work to prevent acne lesion formation. Sirolimus is a selective inhibitor of mTORC1 that historically has been used as an immunosuppressant for solid organ transplants. But recently, topical sirolimus was FDA approved for the treatment of angiofibromas associated with tuberous sclerosis. And generally, it has a good safety profile and no serious side effects. Sirolimus has also been used topically for other skin diseases, such as EBS, psoriasis, and probably most interesting to this group, rosacea. So based on our data, we hypothesized that topical rapamycin would be well tolerated and possibly effective for preventing acne. So to summarize, we showed that the non-lesional skin of acne patients has a distinct gene expression profile relative to the healthy control skin. We showed that metabolic gene sets were positively enriched in the non-lesional acne skin, and that it also had an altered epidermal differentiation profile. And then we used a computational approach to identify novel compounds for acne treatment and found that mTOR inhibitors emerged as top candidates. So I would like to thank my lab, as well as the AARS for sponsoring this and our funding sources.